Yes, thank you very much for meeting with me tonight. I want to say good afternoon to Representative Woods, Senator Cabrera, Representative Berry, Senator Anwar, and other esteemed members of the Insurance and Real Estate Committee. My name is Gary Opin, and I'm an orthodontist who practices in Milford, Connecticut. I'm a second-generation practitioner, and I'm very fortunate to be able to practice with my father, Perry Opin, who started our practice in the year 1966. We currently employ 8 members in our staff, and I went to Colgate University. After that, I went to Tufts University, getting my dental degree, and after that, I obtained my master's degrees and certificate in orthodontics at the University of Connecticut. My education on the field is always ongoing as technology and clinical advancements evolve, and my practice reflects these innovations. I'm a member of the American Dental Association, the Connecticut State Dental Association, the Milford Dental Society, and the American Board of Orthodontics. I am also currently an assistant professor at Yale University and the University of Connecticut in their Department of Orthodontics, and I'm a member of both of their craniofacial teams. I want to add a moment of clarification on the role of an orthodontist in a person's life. While the reputation of providing straight, beautiful smiles is certainly a source of pride for me, the work that I and my colleagues perform to attain or restore functionality to the oral cavity is incredibly important and often a complex treatment plan. I have a significant of my practice devoted to patients with different craniofacial problems, be it birth defects or syndromes. These cases can range from a cleft palate to a patient missing part of a jaw, or we have even patients that are missing appendages. We have a few right now that are missing a nose that we need to reconstruct their oral cavity before this can be made. These cases require a team of doctors and countless numbers of surgeries. Our goal is always to provide these patients the ability to chew, swallow, and to smile. I chose the path of orthodontics because my father showed me that this profession gives us the ability to directly and significantly impact the lives of people in our community. We see our patients throughout their lives and in around town. Our relationships continue well beyond their treatment. It is incredibly important that our patients trust us with their oral health care. Proudly, I'm an active member of Rotary, and our motto is service above self, which I take every day into our practice. Thank you for allowing me the opportunity to comment on Raise Bill 6832, Act concerning electronic notifications for prior authorizations. While this bill, as written, will provide the prior authorization process in the future, I feel it does not go far enough to aid our patients and families with the challenges we face today. I ask that my comments today on Raise Bill 6832 also be included in the record for testimony on Raise Bill SB 6. I am with dentistry. Prior authorization also affects every patient I see. With this authorization that they were talking before, some of these patients, we have to treat for 4 or 5 years to have multiple surgeries. And if we get a prior authorization, then they come up for the surgery and it's denied. We've done all this work for the past 4 or 5 years, and we're not able to get to that final step. So that would be my summary with this.
Thank you very much for your testimony today.